So today we'll begin with non-communicable disease. It is also one of the important full question in your theory exams, and also it can be given as a case in your field study. So this is very important, also important from MCQ point of view also. And so WHO has defined blindness as visual acuity of less than 3/60 according to Snell's chart or its equivalent. All of you have must seen Snell's chart. Yes or no? Where have you seen it? Ophthalmics department, right? OPD. So that what is its use? For vision testing, right? So the definition is according to Snell's chart, that is when the acuity of vision is less than 3/60 or its equivalent, we say it is blindness. In the absence of appropriate vision charts by non-specialized personnel, the WHO has now added that inability to count fingers in a daylight at a distance of 3 meters. If we are not able to count fingers at a distance of 3 meters in daylight, then that is equivalent to 3/6, less than 3/60 or its equivalent. This is Snell's chart, right? Here this is given in meter and this is distance is given in feet, and we have to read this letters at these distances. Categories of visual impairment. So there are two categories, either low vision or blindness. In case of low vision, if the vision is 6/18 or less than 6/18 up to 6/60, then it is low vision, or if it is less than 6/60 to less than 3/60, then it is also the second category of low vision. And in blindness, there are three sub-classifications. One is 3/60, that is finger counting at a distance of 3 meters. If the vision is 3/60 or less than 3/60 up to 1/60, then it is blindness. Or this is another criteria, if the vision is less than 1/60 and there is light perception. And if there is no light perception at all, then this all are categorized as blindness. Problem statement: globally we have 1 billion people with vision impairment, and this is preventable blindness. The question has been asked last time: enumerate the causes of avoidable blindness. Okay, that was a full question in your senior batch. So 80% of blindness is avoidable, and major cause of blindness and their estimated prevalence are: number one, that is the maximum is cataract. Because of cataract blindness, 19 million are blind. Glaucoma 6.4 million, trachoma 5.6 million, childhood blindness is also more than 1.5 million, and other causes, rare causes, they also form 10 million. 32% of world blind, they are 45 to 59 years old, and 58% they belong to elderly age group, more than 60 years. Nationally, this survey has been conducted in 2015 to 18, which shows projected prevalence of blindness to be 0.36%. And before this 15-18 survey, the previous survey conducted in 6-7, prevalence was 1%. So you can see that we are seeing the reducing trend. 6 to 7% of children 10 to 14 years, they have problem with their eyesight. And what is the most common eyesight problem in this age group? Refractive error, right? So that's That can be myopia, hypermetropia, but it is refractive error. Now, causes of blindness. In developed world, accidents, glaucoma, diabetes mellitus, vascular disease, cataract, and degeneration of ocular tissue. This xerophthalmia, congenital cataract, congenital glaucoma, and optic atrophy. These are causes of childhood blindness. So 1519 survey has shown that cataract is responsible for 66.2%. This is the prevalence of India. Uncorrected refractive error, it forms 0.1%, glaucoma 5.5%, and this posterior segment pathology responsible for 5.9%. Trachomatis corneal opacity is responsible for 0.8%, and other miscellaneous causes 6.2%. So what is the determinant? What are determinants of epidemiology in causation of blindness? Age factor, here in children and young age group, refractive error, trachoma, conjunctivitis, malnutrition, they are the important causes of blindness. In adults, cataract, refractive error, glaucoma, and diabetes mellitus. Gender-wise, high prevalence of trachoma, conjunctivitis, cataract, these are more prevalent in women as compared to men. Malnutrition, infectious disease of childhood, especially measles and diarrhea, they are responsible for blindness. Severe blinding corneal destruction due to vitamin A deficiency. And that's why in NIS, National Immunization Schedule, at the age of 9 months, we give, what we give? Along with measles, what we give? Vitamin A. No? That is to reduce this blindness, because severe blinding corneal destruction due to vitamin A deficiency, and that is because of malnutrition, which may lead to infection like measles. Occupation, here people working in factories, workshop, industries, they are prone to eye injuries because of exposure to dust, airborne particles, flying objects, gases, fumes, and radiation. So this is occupational hazard. And when the question is regarding occupational hazard or occupational injury, this should be enumerated as one of the causes. Social class, here blindness prevalence is twice more common in poor classes than in the well-to-do class. Social factors responsible are ignorance, poverty, low standard of personal and community hygiene, and inadequate health care services. How can we prevent? There are national programs for the prevention of blindness, which comprise the following. Number one is initial assessment. Two, method of intervention like primary eye care, secondary, tertiary, specific programs, long-term measures, and evaluation. So these are the steps. And what include in initial assessment? We must know about the prevalence. कितना है problem in the geographic distribution. इस area में अगर देखना है तो how much is the problem? So we have to assess the magnitude, geographic distribution, and causes of blindness within the country by survey. Then methods of intervention include number one, primary eye care. Here wide range of eye conditions can be treated or prevented at grassroots level by locally trained health workers who are first make contact with the community. They are also trained to refer the typical cases to the nearest PSC or district hospital. Activities, they involve promotion of personal hygiene, sanitation, good dietary habits, and safety in general. So this all are the components of health education. Then the final objective is to increase the coverage and quality of eye health care through primary healthcare approach and thereby improve utilization of existing resources. Secondary eye care, it involves definitive management of common blinding conditions such as cataract, tracheasis, entropion, ocular trauma, glaucoma. By this time you must know what is cataract, what is tracheasis, what is entropion from your ophthalmological knowledge. It is provided in PSC and district hospitals where eye departments are established. It may involve the use of mobile eye clinics also, where in peripheral parts or where these facilities are not available or hard to reach areas. It may involve the use of mobile eye clinics. The great advantage of this strategy is it is problem specific and makes best use of local resources and provides inexpensive eye care to the population of the periphery. At tertiary level, this is established in the national or regional capital and often associated with medical college and institute of medicine. They provide sophisticated eye care such as retinal detachment surgery, corneal grafting. These are not available at the grassroots centers. Other measures of rehabilitation comprise education of blind in the special schools and utilization of their services in the gainful employment. Have you visited National Association for Blind in Golapar? No? So you might be visiting your this 6th semester clinical posting, NAB, National Association for Blind. कहाँ पे है ये? गोलापार में. So that is a special school for blind. Specific programs for control of trachoma, school eye health services, screening, treatment, health education, vitamin A prophylaxis, occupational eye health services. What is this vitamin A prophylaxis? पहला विटामिन ए कब देना है? इस पे दे दिया, दैट इज 1 लाख इंटरनेशनल यूनिट है ना, और 1 लाख बिलो 1 ईयर, 2 लाख अबोव 1 ईयर. सो 2 लाख कब से देना है हमें? आफ्टर 1 ईयर. सेकेंड डोज कब देंगे? अलॉन्ग विथ डीपीटी का जब बूस्टर लगता है तो वी गिव दिस सेकेंड डोज ऑफ विटामिन ए. उसके बाद एट 6 मंथ इंटरवल रेगुलरली अप टू द एज ऑफ 5 ईयर्स. ठीक है, ये वाइवा में बहुत कॉमनली पूछते हैं, तुम वो भी नहीं बता पाते हो. सो बी केयरफुल अबाउट दिस, ये क्वेश्चन इंपॉर्टेंट है. लॉन्ग टर्म मेजर्स. लॉन्ग टर्म मेजर में क्या हो सकता है? दैट इज एम्ड एट इम्प्रूविंग क्वालिटी ऑफ लाइफ बाय मॉडिफाइंग और अटैकिंग द risk factors which are responsible for the persistence of eye health problems like poor sanitation, lack of adequate safe water supply, poor nutrition and lack of personal hygiene. Now, what is the program related with this? Blindness. National Program for Control of Blindness and Visual Impairment. And this program was launched as NPCB in 1976. Centrally 100% centrally sponsored program. इसमें स्टेट का कोई भी फंडिंग नहीं है. All funding is from central government. It incorporates the earlier trachoma control program. सबसे पहले क्या हुआ था? Trachoma control in 1968. Then we launched 1976 NPCB. That trachoma control program is merged with this program. What is the goal of this program? To reduce the prevalence of blindness from 1.4 to 0.3%. So that was our objective. Now we are at 0.36% according to 2019 survey, right? So what are the objectives? To continue 3 ongoing signature activities, that is performance of 66 lakh cataract operation per year, school eye screening and distribution of 9 lakh free spectacles per year for refractive errors, and collection of 50,000 donated eyes per year for keratoplasty. To reduce the backlog of avoidable blindness through identification and treatment at primary, secondary and tertiary levels. To develop comprehensive universal eye care services and quality service delivery. 4th is strengthening and upgradation of Regional Institute of Ophthalmology to Center of Excellence in various subspecialties. 5th is strengthening of existing infrastructure facilities and to develop additional human resources for providing eye care in all districts. To enhance community awareness on eye care. To increase and expand research for prevention of blindness and visual impairment. To secure participation of voluntary organization or private practitioners in delivering eye care. What are the strategies of program? Continued emphasis on free cataract surgery to government healthcare system and through NGOs and private sectors, making the program comprehensive by including disease other than cataract like diabetic retinopathy, glaucoma, corneal blindness, vitreoretinal surgery, childhood blindness. Active screening of population more than 50 years for cataract. Screening of children for refractive error and provision of free glasses to the needy. Coverage of underserved areas, capacity building of eye care providers, IEC activities for creating awareness on eye care in the community. RIO, क्या है RIO? अभी बताया था. Regional Institute of Ophthalmology. Center of Excellence and Medical College to be improved and strengthened. District hospitals also to be strengthened by upgrading infrastructure as well by increasing number of contractual staff and funding. Emphasis on primary eye care and establish vision centers on all PSCs. Creating multi-purpose district mobile ophthalmic units for improving coverage. Now this is the organizational structure for NPCB. क्वेश्चन अगर आता है तो ये बनाना मस्ट है. 2 नंबर इसी के मिल जाएंगे. This is the administration structure at central level, state level and district level. Central level पे क्या है? Ophthalmology section, Directorate DGHS, Ministry of Health and Family Welfare, New Delhi. ठीक है? तो central level पे which ministry is handling this program? Ministry of Health and Family Welfare. Then at state level we have State Ophthalmic Cell, Directorate of Health Services, State Health Societies. डिस्ट्रिक्ट लेवल डिस्ट्रिक्ट ब्लाइंडनेस कंट्रोल सोसाइटी, इसको शॉर्ट में हम DBCS भी बहुत फ्रिक्वेंटली यूज होता है DBCS. देन एट दिस ग्रास रूट लेवल, प्राइमरी लेवल क्या है? सब डिस्ट्रिक्ट लेवल हॉस्पिटल, CSC, मोबाइल ऑप्थेल्मिक यूनिट्स, अपग्रेडेड PSC एंड लिंक पर्पस. सो दिस if the problem is not handled at this primary, they will be referring to district hospital and NGO eye hospital at secondary level. Here the patients may be referred to tertiary level, that is at Regional Institute of Ophthalmology and Center of Excellence in Eye Care Medical College. Right? What are the activities which has to be covered under this program? Cataract operation, involvement of NGO, IEC activity, information, education, communication, management information system, MIS, school eye screening program, collection, utilization of donated eyes, control of vitamin A deficiency, monitoring and evaluation by conducting regular survey, periodic survey. So cataract surgery to be done by IOL, intraocular lens implantation. So here you have to identify the blind and list them in the village register, organize screening camps for confirming the cataract blind for referral, transport the cataract blind to the base hospital, follow-up of the operated cases, carrying out refraction and providing best corrective spectacles. So this is the data of the cataract operations done, and we have increased the number of cataract operations from the year 92 to 93 to about 63 lakh. It was about 63 lakh in 92 and increased from 16 lakh to 63 lakh. So this, for continuing this rate, we have to operate 400 cataract surgeries per lakh population to clear backlog of cataract blindness. So percentage of this IOL surgery, this has also increased from less than 20% to 95%. School eye screening program. Here 5 to 7% of children aged 10 to 14 years, they have problems with their eyesight affecting their learning at school. Teachers have been trained to screen the children. Screening is to be done on an annual basis. After confirmation by ophthalmic assistant, glasses are to be prescribed or provided free of cost to the poor. So this is also, this data is showing an increasing or rising trend. And this is collection and utilization of eye donation. So this corneal blindness, which is 1% of all cases of blindness, and this is mainly this occurs in children and young adults. The common causes being vitamin A deficiency, eye infections and injuries. So donated eyes, this has to be removed within 6 hours. This 6 hours is important. After that, all the task will be useless. It is to be preserved in specific solutions in eye banks and utilized for transplantation within 72 hours. 6 घंटे में निकालना है, 72 hours में लगाना है. Eye donation fortnight कब से कब होता है? This is also important question. 25th August to 8 September. ये जो duration है, that is observed as eye donation fortnight, and that is to promote eye donation and eye banking. So development of infrastructure is also important. Construction of this eye wards, operation theaters and dark rooms. This construction was taken up during 9th 5-year plan and mainly in the states covered under the World Bank assisted cataract blindness control project to enhance capacity of eye care to the public sector. IEC activities are taken up at central level, state level and district level. All the levels, they have to carry out these IEC activities. And this special campaign for mass awareness, again this has to be carried out during this fortnight, 25th August to 8 September, which is observed as eye donation fortnight. And World Sight Day, this is second Thursday of October. At the central level, the IEC prototype material is produced and disseminated to the states. Quarterly newsletter also has been started since July 2002, and voluntary organization, they also require support and they can play an important role in implementing various activities under the program. Management information system, that is to facilitate monitoring of trends in performance and analyzing epidemiological situation on blindness. A computerized information system that has been set up in the 25 sentinel surveillance units initially. The cataract surgery data is certified for gender, social status, type and place of surgery. The new initiatives in 12th 5-year plan, that is distribution of free spectacles for near work to old persons suffering from presbyopia. Telemedicine in ophthalmology department, provision of multi-purpose district mobile ophthalmic units in all the districts all over the country. So these are the new initiative and begin in 12th 5-year plan. This is also important. Vision 2020. Short notes on Vision 2020 frequently asked. Right to sight. Global. This is a global initiative to reduce avoidable blindness. Avoidable means preventable and curable by the year 2020. Target diseases are this: cataract, refractive error, childhood blindness, corneal blindness, glaucoma, diabetic retinopathy. So this pyramid is very important. Here you are seeing this primary level. At the primary level we have vision centers. 20 number is important. 20,000. So the activities here are diffraction and glasses prescription, primary eye care, school eye screening programs, screening and referral services. Then at higher level, at secondary level, we have 2,000 service centers. Activities are cataract surgery, other common eye surgery, facilities for refraction, referral services. Then at tertiary level, here we have training centers, number 200. 200 training centers and 20 center of excellence. And at this training center, we have tertiary eye care department training and CME. Center of excellence, which are 20 number. The activities ongoing here are professional leadership, strategy development and CME, laying standards, quality assurance and research activities. So this pyramid is very, very important. And then universal eye health, global action plan. The vision of this action plan is a world in which nobody is needlessly visually impaired, where those with unavoidable vision loss can achieve their full potential and where there is universal access to comprehensive eye care services. WHO estimates that if only 2 major causes can be controlled, the first to cause a cataract, glaucoma, so that 2/3 of visually impaired can retain good sight. So this is a universal eye health global action plan. These 2 measures are, if you provide this refractive error services, उसमें हम लोग क्या कर रहे हैं? Free checkup and providing free spectacles to the needy. Then cataract operations, the number बता दिए थे, number पहले थे 16 lakh to now it is about 63 lakh. So providing cataract surgery and refractive services, we can reduce 2/3 of visual impairment. The basis of reduction of avoidable blindness depends not only on specific eye care services but also on other sectors like RCH. RCH क्या है? What is RCH? Reproductive child health. So here if we provide immunization against rubella, measles, है ना? देते हैं ना MR के साथ में क्या दे रहे हैं हम? Vitamin A. So that is important to reduce blindness in childhood. Then nutrition. Again, malnutrition is also important factor. So nutrition being important here. Prematurity, safe water and basic sanitation for improvement of personal hygiene. Also, eye health is influenced by control of non-communicable diseases like diabetes, hypertension, communicable diseases like trachoma, geriatric healthcare problems, cataract. Hence, eye health services can be strengthened by integrating into primary healthcare. WHO has suggested 3 indicators for helping the countries to assess if the universal eye health is adequate or not. So, what are these 3 indicators? Number 1 is prevalence and causes of visual impairment. Target has been set as reduction of avoidable blindness by 25%. ठीक है, ये टारगेट याद करना है 25% by 2019 from the base level of 2010. The number of eye care personnel को naturally increase करना है. Cataract surgical service delivery that has to be improved. So number of surgeries performed per million population in a year. इसको क्या बोलते हैं? Cataract surgical rate. So that number of individuals with bilateral cataract induced impairment who have received cataract surgery on at least one eye. So that is cataract surgical coverage. So, यहाँ पे externally aided projects जो कि externally aid मतलब कौन कौन से ये ऑर्गेनाइजेशन है जो इस प्रोग्राम में एड कर रहे हैं. नंबर 1 is WHO. We know apart from WHO this वर्ल्ड बैंक, देन नेशनल, ये इस प्रोग्राम को यहाँ डानिश, ये डानिश का भी फुल फॉर्म, डेनिडा का फुल फॉर्म भी पूछते हैं. डेनिश इंटरनेशनल डेवलपमेंट एजेंसी, डेनिश इंटरनेशनल डी फॉर डेवलपमेंट एजेंसी, डेनिडा. ठीक है, ये पहले एमसीक्यू में भी ये क्वेश्चन आता था. सो वर्ल्ड बैंक assisted cataract blindness control project that is from 94 to 2002 has been implemented in 8 states. 15 million operations has been done. IOL implantation had been increased. Danish assistant to NPC. So this all is what we have achievements of this program. So this is again eye donation fortnight, National Eye Donation Fortnight, which is observed from August 25 to September 8. Donate your eyes to help someone see. इसके लिए क्या करना है हमें? Within 6 hours of death, eyes has to be removed and within 72 hours we have to plant. Right? So this was about NPCB and very important question.